And here's my biggest tip that everyone should do before leaving your doctor's office. What type of doctor should you see for hair loss relating to iron deficiency? You should look to find a doctor who understands that low ferritin will affect your hair growth. All doctors know that anemia is a problem and needs treatment, but not all doctors check your ferritin to see if you are iron deficient. Many doctors don't seem to know that even if your ferritin is in the normal range, it can still be way too low to grow proper, healthy hair. If you have uncomplicated iron deficiency or even mild anemia with iron deficiency, and it's responding to your oral iron supplements, your iron pills, then you probably don't need to see a specialist. Your family doctor or your primary care provider might be the only doctor that you need to see as long as they are willing to check your blood regularly. But if you have something more complicated going on, for example, if you've raised your ferritin enough and your hair is still not growing back, or you have been taking iron for a while and your ferritin isn't changing, then you might need some additional tests. Your family doctor should be able to do these more in-depth iron studies, and depending on the results, they might send you to a specialist. So if something unusual does come up, they likely will send you to a specialist, and the specialist might be a hematologist if you have that available in your area, or even a gastroenterologist if they suspect something else might be going on, like celiac disease or another absorption disorder. So your first step is to visit your family doctor, and they should do the tests needed to check what's going on with you. And it's a pretty good idea to make sure that you do this before you start taking iron, because having too much iron in your body is actually dangerous. So you want to make sure that you're tested and you actually have iron deficiency before you start taking iron supplements. And here's my biggest tip that everyone should do before leaving your doctor's office. So when they hand you that requisition form, actually read it. So actually look at it and make sure that the tests that you're expecting are actually checked off on the form. And if there's anything that you don't understand on the form, feel free to ask your doctor, because that's what they're there for. And it's up to them to tell you what tests they ordered and not just hand you a piece of paper and send you out the door. And my husband was actually the worst for this. So he would come home from the doctor and I'd ask him which test the doctor ordered, and he would just shrug and say, I don't know. So now he knows better, and I always prep him in advance before his appointments and tell him what tests he should be asking for. So yes, I'm one of those people that goes to the doctor's office and already knows what they're going to be asking, but in my opinion, it's best to advocate for yourself, because no one is as invested in your own health as you are. So going to your doctor, they only have a certain amount of time, and they're only going to ask you the questions that pop into their head at that time. So you got to make sure that you're the one advocating for yourself and you know what you want them to test. I mean, of course, doctors have a lot of knowledge that they've gained over the years through their schooling and also through practical clinical experience. So they will, of course, know what they want to test you for, but I'm just saying that it's always good to know what you think is going on so that at least you can make sure things are covered. So know that it's okay to advocate for yourself and ask for the tests that you need. And I also used to be one of those people that just went to the doctor and let them decide what to do and not even look at my requisition. But now I know that no one is as invested in your health as you are. And if your care provider gives you a hard time when you ask for a ferritin test, even when you tell them that low ferritin is related to hair loss, maybe try seeing a different doctor if you have that option. I'm not sure how it works in other countries, like the United States or India, but here in Canada, you have a family doctor who you see for all your healthcare issues. And there isn't really an option, at least where I live, to just go see a different doctor. So hopefully the doctor that you see is going to work well with you. And what do you do if they're not? What do you do if you're stuck with a doctor that isn't working well with you? So maybe you can try asking them if they can at least test your ferritin. In the description, I'll put a link to a study that shows that there's a link between low ferritin and hair loss. So maybe if you bring that to your doctor or send it to them, then maybe they'll be more open to testing your ferritin for you. So a story related to this is that when I was pregnant with our first child, I asked the midwife if she could test my ferritin because I knew it had been low in the past. I mean, I didn't know that I needed to take iron to fix it, but I knew it had been low. So I asked her, can you test my ferritin? And she said, oh, no, we don't do that test. It's too expensive. And I'm thinking, okay, I've never heard any doctors say that before. And also, we live in Canada, so everything's paid for. So that's just an example of how some healthcare providers just don't do the ferritin test for whatever reason. This was, of course, a while ago. So hopefully things have changed and now doctors are more open to doing that test. Let me know in the comments what experiences you've had with your doctors, especially in dealing with the iron deficiency as it relates to your hair loss. And take care, everyone, and I'll see you in the next one. Waiting for the plane. Waiting for the plane. And I'm sorry if you can hear planes in the background. I usually don't record with the windows open, but I've got all the windows in my house open today because it's really nice out and there seems to be a lot of planes flying around. So apologies for that.